Hello and a very warm welcome to our channel, or for those of you who've been here before, a warm welcome back to our channel. Today I am going to be talking to the absolutely wonderful Dr.Vora about exercise in pregnancy, a topic that both Dr. Kushi and I get asked quite a lot. So we decided it was time to bring you a YouTube video where we can answer, hopefully, most of your questions. But obviously, if there are additional questions, you can always comment down below and we can give you some additional information. Now, before we get started, I just want to say a very warm welcome to Kushi. Thank you so much for joining us. I am so pleased to have you join us. We've been talking about doing a video together for quite a while, so I'm very glad to have you here. Before we get started, would you mind introducing yourself to everyone so that they can learn a little bit about you?
Sure. So I'm Dr. Vora. I'm a chiropractor by designation. My passion is in women's health, so prenatal, postnatal care, as well as a little bit of a pediatric care. And I currently work out of the wonderful town in Milton, Ontario.
Thank you so much for joining us. I'm excited to have this conversation. In terms of pregnancy, there's so much information that's out there. There's so much information on the internet. And of course, how do you decide whether it's good information or perhaps, quite detrimental information? So do you have a starting point for what you would recommend for people? So where should they get their sources of information? Because we all know Dr. Google is not the answer.
No. So I definitely recommend, one is a self-assessment. So definitely take a look at your lifestyle currently and determine where you stand with that. A lot of people are in physical jobs, and sometimes that can be good in terms of, getting some amount of physical activity. However, our body does adapt to that. So intentful exercise outside of that is important. So one is a self-assessment. Second one is actually seeking advice from someone who's trained in this field. One is your family medical doctor, any other sort of paramedical, so like physiotherapy, chiropractor, occupational therapy, osteopaths as well are a great resource to start the conversation for sure. Assessments normally are typically done by your medical doctor, and clearance for exercise during pregnancy is done by your medical doctor. So I would say first is take a look at what's going on in your life, your lifestyle, how much do you do already? And then secondly, consult with someone who's, gone to school for these things. So definitely consulting someone that you see regularly. So either physiotherapist, chiropractor, the osteopath, or the OT, so the occupational therapist, and then your medical doctor as well.
And does everybody need the all clear when they get pregnant to continue exercising or to start exercising? Because if you've already been exercising, can you continue to exercise? Do you still need to get the all clear? And the second part of the question is, if you have been exercising, should you continue with exactly the same types of exercise, sort of the more intense types of exercise?
So definitely with the first question, if you have been exercising before pregnancy, you're more than likely to be okay to continue the exercise. The difficulty does happen when you are exercising at certain intensities. So if you're normally used to a moderate to vigorous activity intensity, you have to be a little more mindful now, because you are not just pumping blood to your own body, you are pumping blood to potentially either two or one child inside. So you're doing, double the hearts, double the brains. And so you have to be considerate of the amount of, blood being pumped around the body. So if you're changing activity from, say, being fit at a moderate level of intensity and then getting pregnant and then continuing that's okay. But if you're going to change to, say, you decided I do want to do a high intensity workout, that's a bit more difficult. And so that's when you should definitely seek clearance. And then if you, as I said, the first self-assessment to determine where your health and your fitness is at. And if you've never been exercising before pregnancy and you want to start being fit or increasing more physical activity is the best way to put it, clearance is a good idea, because there are certain things, certain injuries that might put you a little bit back in terms of, adopting a physical activity. Because, for example, if I twisted my ankle just before I got pregnant, now I've got all these hormones that might make my ligaments a little more lax. It's wiser to definitely get evaluated to see where I'm at in terms of the health of my ankle, the strength of my leg and my hips and my knees to support any activity that I might adopt going forward.
Okay, so what you're saying is don't pee on a stick and suddenly run to the gym and start running on the treadmill.
Exactly, 100%. If you're going to start something new, get assessed. If you've already been doing that, you can continue it with certain modifications. But if you're going to change the level of intensity, especially going up, get assessed as well once again, and make sure you have support. Because certain women can do high intensity workouts. However, there is a risk involved with overheating, dehydration. And so always make sure if you are going to change the level of intensity that you do get a clearance, and you work out with someone to monitor how you're doing as things go along.
Okay, so that brings me on nicely to my next question, which is about safety in workouts. So what would you suggest for people to maintain their safety? So like you just said, having somebody with you and making sure you maintain your hydration, but what other suggestions would you have to make sure that what you're doing is safe?
So one of the big things during pregnancy is the risk of falling. So if you're doing things like a high intensity workout, or a moderate intensity workout that involves box jumps or running up and down a set of stairs, these types of things present with the risk of falling. And that's where we get a bit more cautious. So safety wise, anything to do with jumping, sudden change in movement, sudden change in direction, and also, increasing intra-abdominal pressure. So if someone was a power lifter before their pregnancy, things to keep in mind as the pregnancy progresses is definitely intra-abdominal pressure. So how to control breath to let out the pressure that could build up when you are, say, lifting up weights and things like that. So safety wise is learning to control your breath. Other than that, things that could increase your risk of falling. Hydration is a big one, which you've mentioned, which is awesome. Because now, you have to think like twos, I guess is the best way to put it. You can't consider just yourself. You have to consider what else is going on. So you have to drink hydration, drink really well and make sure you're keeping cool. So what you wear also makes a difference. So making sure that you're wearing the appropriate athletic wear that helps you sort of keep cool, not retain that sort of heat when you're working out, and also consider the weather. If it's a really warm and humid day, maybe go out, but not do as intense as a planned workout that you had. You can still go out, make sure you're hydrated, keeping cool, but listen to your body is the big thing. Most injuries happen when, people do too much too soon.
So we're talking there about overheating.
Yes.
So why are we concerned about overheating? Why are we trying to avoid overheating? Because obviously when you work out, you get warm and hot and sweaty. That's what we want to do. But clearly while you're pregnant, overheating is something that we want to avoid. Can you explain a little bit more about that?
One of the big things during pregnancy is your heart rate increases a little bit. And so you are already at a certain point of, increased body heat. And so when you work out, now you're taking that a little bit further. There is a range at which, it's completely fine and completely normal, but there is a point where now if you're sweating profusely and you cannot speak as you work out, that is an indication that you're doing too much. And the overheating factor of it, the risk is the fainting and the dizziness that might settle in, because whenever someone's overheated, it could be a sign of their blood sugar getting lower, could also be a sign of they're actually dehydrated and need to take a rest. So the risk of falling increases because at that point your body gets really fatigued, and so you want to definitely take a pause and let yourself cool down. because now you're pumping blood, not only, as I mentioned, for yourself, but also for the babies. So definitely keeping that in mind. And body regulation. So we are, as adults, are able to regulate our bodies, but our fetuses rely on us to regulate their body temperature. And so when you're overheating, essentially you need to like pause and let things cool down, because that obviously can cause a little bit of increased blood flow to the pelvic floor, to other areas, and that could essentially cause discomfort.
Okay. So when it comes to safely exercising, we offer prenatal yoga, and
Yes.
we know that that is a specific modality that is very safe for pregnancy. So that's one option. But if people are looking for other types of exercise that they can do, whether, let's say, for example, if you haven't been exercising before,
Yeah.
what types of exercise would you suggest for people who are beginners to exercise, and now that they find themselves pregnant, they're a little bit more interested in their body and their condition, and sort of building up some strength as they go towards the labor and the birth of their baby?
Yeah. So group exercises are really great. And I'm really glad that you mentioned prenatal yoga, because one, it's really nice to go through the journey of fitness with somebody else, especially while you're going through a pregnancy. Making those connections is really good, mentally speaking, but also physically speaking. But in terms of options, the great thing about exercise is it doesn't have to be complicated. You know, if you're a completely beginner in terms of like exercise, walking is a great way to start. Just timing out how long you can handle like walking, and seeing when you start to get tired, and that could be your end point. And okay, today I was able to walk 10 minutes without, getting out of breath and not feeling warm. Next day, try 15, right? And if you notice that about maybe at 20-minute mark, you start to get a bit winded, that's your max point. And then you can start to sort of build up every day. So hit 20, walk back home, hit 20, walk back home. And once your body starts to adapt, you're going to notice that you can go longer and longer and longer, and you'll start to hit, 30 minutes. And that's the great, just completely beginner, no equipment needed, no group stuff. Always obviously have a partner or a phone that someone can, get in touch with you and make sure you're safe. So that's a great way, is just walking. Outside of that, there are tons of exercises. So prenatal yoga is one. Prenatal Pilates is also another option. The other thing I would definitely encourage is to find a group that's catered to a prenatal sort of aspect to it. And maybe even the fitness professional might already have some certifications outside of the courses they already do. And so always speaking to a group leader that, I'm pregnant and this is how far along I am. And they will always modify exercises for you. So any resistance exercise is also good, but always remember, if you're starting from scratch, make sure there's someone around to guide you with that, especially when doing more resistance-based exercises, so weights or exercise bands, because you need to know how to control your breath to ensure that you're keeping strong, but also not increasing any sort of intra-abdominal pressure, or even putting any risk to, now you're a little bit lax with your ligaments. And so making sure that you're stable and in the good form and having good posture doing the exercise. It's super easy to start something. So definitely just start with some guidance. Otherwise, you can just simply walk.
Wonderful. Is there a particular time that you should or shouldn't exercise in your pregnancy? In the very beginning, should you be exercising or should you be resting? I know that in the first trimester, not a lot of people feel up to exercising because they feel a little green and the nausea has really kicked in. But does exercise actually help with that? I've spoken to a few people who've said that yoga can sometimes help with that. So Is there timeframes when people should or maybe shouldn't be exercising in pregnancy?
Time frame wise, any time is good to exercise. So there is no restriction on that. There are certain contraindications, so things that might put certain women at a higher risk in terms of potential, risk of either bleeding or things like that. And those definitely discuss with your medical doctor first. But most women know when they do have a bit of a high risk pregnancy. And so most women know right off the bat, but they're they're contraindications that are relative. And so it's relative to that individual and absolute. So absolute contraindication means, this is exercise will not help in these situations. And so that woman should probably avoid exercising in those situations. But relative contraindications means as long as there is some guidance involved, they're okay to go ahead and exercise. So time frame wise, any time is a great time to start exercising. Always be mindful of where you start and how long it will take you to get to where you'd like to go. So if someone wanted to run a marathon, right, and if they were starting at their second trimester, the marathon might happen way later, maybe 6 months postpartum, maybe, but always keeping in mind a good time frame, never trying to achieve too much too soon. So always keeping pace with your body. So if your body's saying this was too much, listen to it.
Absolutely. Always pay attention to your body.
Yeah.
In terms of the benefits of exercise, I mean, I feel like we should all really know about the benefits of exercise at this point. But specifically in relation to pregnancy, what are the benefits that we could look forward to for exercising while we're pregnant?
So 2 parts to this. It's not just beneficial for mom, but it's also beneficial for baby. In terms of the research, it has shown in terms of risk of gestational diabetes or gestational high blood pressure, improvements in those, or even completely, reducing the risk. So if someone, could have been at a higher risk of those discomforts is the best way to put it. Exercise definitely helps with that. Outside of that, better sleep, better mood. And, the other thing that I do think is quite important is in terms of aches and pains, improvement in those. For baby, the research is strong in terms of things like, better deliveries, less use of things like instrumented assisted births. For some reason, I guess the exercise is not only helping like the baby be healthy, but also helping the pelvic floor. So during labor, most moms who are already physically active have a little more control in terms of their muscles. Just so during labor, much quicker labors, less pain, which is a great addition, and less instrument use of birth. So like, forceps or vacuums. And that's what they found with a lot of women who have been physically active during their pregnancy.
Well, I don't think anyone can argue with a healthy benefit like that, for sure. Is there anything we haven't talked about today, Chrissy, that you think is really important to get across while we're on this topic?
So I would definitely want to mention some absolute contraindications to exercise. One big thing is, watching out for any bleeding, any fluid loss. Those types of things, listen to your body and seek medical care. Outside of that, one of the other things is definitely make sure that you're eating well. So if you're going to adopt an exercise program, make sure that your nutrition is on par with that. So making sure you're eating well. If you require assistance, always reach out to someone who can help you, a nutritionist, a dietitian, a naturopath, even your medical doctor. So that's what I really do want to hammer home is make sure you have all the things in place that you need. So if you ever need to reach out for help, you have someone to already pull out of your Rolodex and say, okay, I need help with my nutrition, or I need help because I experienced a little bit of bleeding after, my walk today.
So like you said, listen to your body and seek the help and the guidance that you may need if things are not heading in the right direction. Because
exactly.
Exercise should benefit you. It should not be making you, obviously you would be scared and concerned and worried. So that's not what exercise is designed to do for you.
Exactly. So listen to your body, right? A big thing is listen to your body. Don't push through things.
Wonderful. So the takeaways from today's talk then are that exercise is great for everybody. It's okay to do it, providing you get clearance from your primary care provider, and that it does have some benefits for you as you go to give birth. So sounds like a pretty big win-win for me. Dr. Dr.Vora, thank you so much. It has been an absolute pleasure to chat with you. I am very, very much looking forward to our next conversation. So Dr. Vora will be here with us for a series of talks, which we are very excited about. And so you can join us next Thursday at 11 a.m. for our next YouTube video. If you have found today's video helpful, enjoyable, if you got some information, then please do give us one of those thumbs ups. And if you are enjoying the conversation, then please do subscribe to the channel so that you can get notified every time that there is a new video. So from Dr. Vora and from it is goodbye for now. We hope that you will enjoy your next safe exercising session. And if you do have any comments, then pop them down below. We would love to hear what you have to say and let us know what exercise you found most beneficial in your pregnancy. Thanks, Dr. Vora. We will chat with you all very soon. Until next time, take care. Bye-bye.
Bye-bye.